CAR T-cell therapy stands for chimeric antigen receptor T-cell therapy. CAR T-cell therapies at the present time are approved for treatment of B-cell type acute lymphoblastic leukemia in patients up to age of 25 years who had failed 2 preceding lines of therapy. For lymphomas, CAR T-cell therapy is approved, and there are currently 2 commercially approved products for treatment of patients with diffuse large B-cell lymphoma who has failed 2 prior lines of therapy. Also for patients with transformed lymphomas from follicular lymphomas, and an entity called primary mediastinal large B-cell lymphomas. So those are the 2 indications at the present time. So lymphocytes are cells that normally in our bodies are responsible for immune surveillance and getting rid of or trying to control infections like viral infections. And also those lymphocytes or various type of lymphoid cells actually are responsible for cancer surveillance. So they are able to identify and get rid of cancer in normal functioning conditions. Unfortunately, in cancer patients or in patients with lymphomas, there is those lymphomas or lymphocytes are not able to, either they don't recognize the target, or if they recognize it, they cannot get rid of it. So by getting those cells out and re-engineering them with a receptor, we are teaching them to go exactly after a particular target and getting rid of it. How do these cells work? And what is done is the cells, those lymphocytes actually, what we call T lymphocytes, there is a chimeric antigen receptor, which in this case, the 2 products that are currently available or approved for commercial use are actually using the same target, which is CD19 or CD19. And what is being done is actually those receptors are being incorporated into the lymphocyte, so the lymphocyte knows exactly where to find those lymphoma cells that are expressing that CD19, binds them and neutralizes them, and eventually kills them. So, for instance, patients who achieve a complete remission by 90 days from the original treatment, those are the patients that are destined to do the best. Patients who have less than a complete remission are more likely or at a higher risk of actually having a disease relapse in the coming months. The probability of achieving a complete remission to any treatment after you have failed 2 or more lines of therapy is probably less than 10%. When we're looking at CAR T-cell therapy, and some early data is showing that number of or that percentage of complete remission can be over 40%. So it is certainly amazing that patients who have been told by their hematologist that your life expectancy is few months, these patients now are having a second chance to life. And we have had cases where patients have come to us with this treatment being the last resort, and patients have responded well. With CAR T-cell therapy, at 2 years from the time these patients are treated with CAR T-cell therapy, the overall survival has improved to approximately 52% or so. So certainly these are promising therapies. So my hope for the future is that probably these therapies will continue to evolve. So we are seeing a new generation of treatments in cancer care. And we have always heard and talked for many years about the concept of personalized medicine. And this is the true representation of what personalized medicine is, where you're getting the patient's own cells and generating their CAR T cells using their own cells. So this certainly exemplifies a step in the right direction. I think that these therapies over time will become more effective and will become hopefully less toxic and will be more better tolerated for the patients.